Hi viewers, first we are going to learn about the medical emergency and first aid procedure. In that, the first is choking. Choking can happen anywhere, anytime, with any age group. Choking is a life-threatening situation and happens when the casualty's airway suddenly gets blocked so they cannot breathe normally.
Right?
Recognition, grasping of the throat, anxious and distress, difficulty in speaking and breathing, persistent cough, and becoming unconscious. Calm and reassure, encourage coughing,
Cough.
stand behind, lean them forward, support upper chest, and with the one hand, give sharp back blow between shoulder blades. Give 5 back blows. Check the mouth and remove obstruction. If unsuccessful, give 5 abdominal thrust. If not clear, after 3 cycles, go for life-threatening support and call emergency 911. Just like choking, seizure needed a medical emergency and it can happen anywhere, anytime, and it is not predictable.
A seizure is an episode of abnormal electrical signals in the brain that result in disturbed brain function, shaking or contraction of limbs, and altered consciousness. Seizures can occur at any place. Move any potentially harmful objects out of harm's way to prevent injury. Do not restrain the person and give him or her head support. After the seizure ends, move the person onto the side. Tilt his or her head back to protect against choking from possible vomiting. We often encounter various injuries on daily basis, such as small ones, which include cuts, scrapes, bruises, blisters. They do not have any lasting consequences. However, regardless of their injury nature, if not treated correctly, then this may need medical emergencies. And now let's have a check on first aid procedures for each of them. Simple one. It will have dirt ground into the skin, so make sure it is clean. You may have to scrub a little. What to do? Step 1. Stop the bleeding. Step 2. Clean the wound. Step 3. Apply antibiotic. Step 4. Cover the area with bandage. If bleeding cannot be stopped in 10 minutes, call 911. Blisters. Blisters are usually formed on the foot or the hands. The common cause is from rubbing inside the shoe or the glove. Treat blisters as a wound. Clean with soap and water. Usually, don't break deep blister. Some superficial blisters can be lanced with a sterile needle, then cleaned and bandaged. Keep off the pressure by changing the socks and gloves and bandage the area. Venomous snake bite. Have victim lie down and stay calm. Keep the bitten area immobile and below the level of heart. Call 911. Wash the affected wound with soap and water. Remove the jewelry or any tight clothing before swelling. Do not try to catch the snake, but note the appearance. If a person gets sunburn, the following steps should be followed. Step 1. Get out of the sun. Staying in the sun for a long time will make it worse. Step 2. Look for the blisters. If the area with blisters is bigger than one entire arm or the whole abdomen, seek medical attention by calling 911 or visiting the emergency department. Step 3. Take a cool shower. Step 4. Apply aloe or another cooling agent. Whatever you use, do not apply butter or oil to any burn. Step 5. Over the counter pain relievers like ibuprofen or acetaminophen can be used for the pain of a sunburn. If stronger pain relief is needed, contact a physician or go to the emergency department. For unconscious victims, perform ABCs, where A is open the airway and B is check for breathing. C is check for circulation at the wrist or throat. How to rescue breathing for non breathing victims. Start immediately if the victim is not breathing. Don't forget to have someone call 911. It is possible that heart could still be beating, only rescue breathing is needed. Rescue breathing techniques. Position the victim on their back. Open the airway. Use a barrier device if you have one, and watch the victim's chest rise. If you are unsuccessful in this rescue breathing techniques, then call 911 and seek medical help.
Head injury is any trauma that can injure the scalp, skull, or a brain. It can be a minor bump on the head or a serious brain injury. There are many causes of head injuries. It's like fall from the height, violent assault, or any motor vehicle accidents. So let's check for first aid and medical emergencies to treat head injury. Warning signs after a head injury. Changes in loss of consciousness, drowsiness, confusion, difficult to arouse. Pupils slow to react or unequal. Seizures, bleeding or water drainage from nose or ears. Blurred vision, loss of sensation to any extremity, slurred speech, vomiting. First aid for head injury. Step 1. Call 911 right away. Check the scene to ensure it is safe. Check the person and the person's ABC. Step 2. If the person is wearing a helmet, leave it on unless it makes it difficult for you to ensure the ABCs are present. Stabilize the head and neck by placing your hands on both sides of person's head. Wait for medical help. Step 3. Provide continual care until EMS personnel arrive. Stop any bleeding by firmly pressing a clean cloth on the wound. If the injury is serious, be careful not to move the person. If you suspect skull fracture, do not apply direct pressure to the bleeding site. Cover the wound with sterile gauze dressing. If the person is vomiting, to prevent choking, roll the person's head, neck, and body as one onto his or her side. Apply ice packs to swollen area.
For medical conditions, there are certain forms that are to be filled by different institutions. For example, Fanshawe College's investigation form. Alright friends, let me introduce you the incident investigation report of Fanshawe College. In Fanshawe College, they have various different things like if you are employee, then there is another option for you. If you're a student, there is another option. If you're a contractor or visitor, there are another option. Let's go for a student. Most of the students, they play in gym, and when they get injured, they seek first aid from Fitness 101 or Athletics department itself. So let's come to the student. For student, they need to feel the section A, B, D, F, G and I. Section A, so that's incidents classification. In that it says like first aid, medical aid, lost time, near miss or recurrence of previous injury. B, personal information of person involved. To complete this section, in this they need to write student number, what's their program, campus location, program coordinator. So in that they need to tell, was the incidents program related, yes or no? Did the incidents occur on placement? Particularly for the students, incident information, date of incidents, need to write the date, reported date, reported to will be people who are responsible, like for example athletics department. Describe first aid treatment if applicable. This first aid treatment is to be filled by the person who gave you this first aid treatment. For is the same like person involved is signature, supervisor or college contact signature and all. That's all with the Fanshawe incident.